Hello, in this session, I'm going to show you how you process ANC registration as well as add ANC visits in EHR. As you can see, I'm already logged in, so we're going to go straight to Workspace, then go to reception. I've already added a client, so I'm going to search for someone with the name Mary. This is the Mary. You view and verify using this patient summary to make sure that you are about to open the correct file. Once verified, open patient file and admit this client is an outpatient to FCHQ, and then send to queue. Proceed to attend to patient. So for now, I'm going to skip the HIV and TB screening and go straight to ANC. All right, so this is our ANC overview. Go to registration. So this would be the first time that this client is booking, and this is not a transfer in. The registration date is today. Their LNMP, I'm going to go with 2020 in December. All right, their cycle is 28 days, the normal blood flow, and then generate an ANC number. The menstrual cycle is regular, and it goes for 4 days, and then you register. So this was ANC registration. And if the partner is available, the system also allows you to update the partner's HIV status. All right, so after enrollment, then you go to previous pregnancies. So suppose this client has been pregnant before, you can add a previous pregnancy and you can also add the pregnancy outcome. So maybe this was a delivery, and the date of delivery would be in 2018, and then you save the delivery. So because the outcome was a delivery, it could have been a live birth or a stillbirth. I'm going to go for now with live birth. Then you can register the child, or you can actually look up the child if the child has already been saved in your facility database. If not, let's go to register. And then save. The birth weight, grams. This client was born in Zambia at a health facility, and it was a normal vaginal delivery. And there are no other birth defects, and then you proceed and save. All right, so now the client has got one child. We can go back to add previous pregnancy if there's a miscarriage that happened or an abortion, and then you can then add as is. Right, so after adding the previous pregnancies, then you can go to this read-only page, which shows you the obstetric history. And you also have a gynecological history. Maybe this one has had cervical cancer done. Right. Bash, 13. 18 years, never had an STI. All right, so we can save. Yes. All right, then after the gynecological history, there's also social history, whether the client has got basic sanitation, smokes, does drugs, or has clean water. And then you also go to visit history. If there's been previous visits before, this is where you're going to see these visits. If there's any investigation history, then you can see, or you can actually record investigation history. So Other than that, you can then go back and you can start your current visit. So this is visit number 1. All right. So if the client is about an RRPF number, you can add the RRPF number here, as well as the date that appears on the voucher. And then you update. Right. Then the vitals. Record the temperature. Record the client's height. Record their weight. Record milk. Okay, so fetal heart rate. You record these vitals. All right, after recording the vitals, you can go to TB screening. Screen for TB. Already the system has calculated the BMI. I'm just going to go with no symptoms for now. Then you confirm. Client is not TB presumptive, yes. Then go to general assessment. Update the details. There's no goiter. And then you update. Go to obstetric examinations, update details. Presentation, fetal position, as well as lie, and then update. Then if there's any diagnosis, you record diagnosis. And then you save your diagnosis. If there are any investigations that you would want to do, record investigation. Which maybe you want to find out their blood group. And then you save. Right. This you're going to send to lab, record another investigation. All right, so I'm going to select syphilis, and then you save. This you're also going to have to either perform or send to lab. But basically, this is how you record investigations. You can also prescribe. You want to give this client ferrous sulfate, 200 milligram tablets, and we're going to give them tablets that they will take orally once daily for 30 days. And then you save. We also want to prescribe folic acid, select 5 milligram tablet, select the formulation. These are taken orally once daily and would like to give for 30 days. All right, if there are any, if you're able to dispense from this particular queue, you can proceed and dispense if you have these drugs in your department. And then we proceed to supplements, update the details, calcium, yes, and maybe protein, yes, and then you update the uptake of these supplements. And then there's also counseling that is going to take place. Update the details about the counseling you've done with delivery method, as well as family planning. And then you update. All right, then there's complications. If there are any complications that you've noted, then you can update. You can add the complications if they are there. All right, then you also give health education. You add the health education that you've given the client. And whether you've given this as a group or as an individual. You can also discuss PMTCT. As a group or as an individual. All right, then there's also vaccinations. In the event that you're going to be giving vaccinations such as tetanus toxoid, combinations with diphtheria toxoid, then you can issue. Minister, tetanus toxoid, 0.5 ml injection, and then you save. All right, go back. So we have some patient alerts here. And we are not going to be able to give the malaria prophylaxis or first HIV test in pregnancy. So I'm going to go back to investigations here. And go to HTS. Then I'm going to go with yes. So now we want to perform an HIV test. And for this, we can refer to the HIV test session that has been saved already.